Back pain. What is back pain? Back pain is a common problem. It is frequently resulted from the strain of normal muscle, ligament, or tendon, and not from critical issue. How is the back structured? The spine, or the backbone, is one of the strongest parts of the body and gives us a great deal of flexibility and strength. It consists of 24 irregular bones, vertebrae, that sit on top of the other separated by in-between discs. Inside the hard vertebrae, the spinal cord travels well protected, bridging the communication from the brain to the rest of the body, aided by the nervous system. What causes back pain? Poor posture. Lack of physical training causing the back to stiffen. Muscle strains and sprains. Some specific conditions linked with a painful back, including spondylosis, sciatica, and spinal stenosis. Common related conditions. Spondylosis. As you have cleverly guessed, your back pain is affected by the wear and tear of the spine. As we get older, the discs inside the spine become thinner, narrowing the gaps between the vertebrae. The condition may be worsened at the edges of the vertebrae and facet joints by the development of bone spurs or osteophytes. Sciatica. Sciatica is caused by the irritation or compression of sciatic nerve roots in the spine. This may result in linked pain or numbness or tingling sensation in the legs. Pain travels all the way down the leg and foot. Fortunately, 60% of people recover fairly quickly, although in some cases it may take a number of months. Other rarer causes of back pain: spinal stenosis, bone problems such as a fracture, an infection, a tumor, inflammation such as in ankylosing spondylitis. When should I see my doctor? You should see your doctor if your pain is very severe or lasts for a long period of time and significantly affects your everyday activities. See your doctor immediately if you have difficulty controlling or passing urine, you lose control of your bowels, you feel numbness on the area of your anus or genital, you have weakness in your legs or are unsteady on your feet. How are back problems diagnosed? Wait and see approach, as most cases of back pain improve by themselves. A quick examination can diagnose most back pain conditions immediately. It rarely requires additional procedures. What tests are there? If needed, a rheumatologist may advise an X-ray, magnetic resonance imaging (MRI) scan, or computerized tomography (CT) scan. What can I do to help myself? Painkillers, paracetamol or non-steroidal anti-inflammatory drugs, NSAIDs. A proton pump inhibitor which will help to protect the stomach. Physical activity. Regular exercise to help you lose weight, as this will reduce the strain on your back. Maintain a good straight posture whenever you sit at home, work, or in the car. When you have to lift something, try to bend your knees and let your spine move without twisting. If it's too much, you can relieve the pain and stiffness by putting a heat pack to the affected area. An ice pack, for example a pack of frozen peas, can also be helpful. Who should treat me? If back pain has still not settled, you need to see a specialist rheumatologist who would advise you specialized treatment accordingly. Why back pain becomes chronic? Though it may seem like the right thing to do when you're in pain for some time, avoiding common activities and movement can actually cause the back muscles to become weak. Your muscle tissues will be fatigued more and become increasingly defenseless against further strain. Bed rest for more than a couple of days is bad for you and makes it harder to get going again. Try to keep active. Gradually increase your level of activity.